Good evening, and thank you for joining our webinar this evening. I'm attorney Lawrence Berliner. I'm an attorney in the field of special education law. And with me tonight is our co-host, Jane Faherty, who's the director of the Jumpstart program at the Jewish Community Center in Stamford. She's also an educational consultant, and she'll be moderating tonight's webinar along with me. And we have our very special guest, returning champion, Dr. Robert Kruger, who was here just about a year ago to talk about evaluations at that time. And we're going to be continuing that discussion about evaluations from a parent's perspective, psychologist's perspective. We have many questions that were submitted prior to tonight's webinar. Some of them are on topic and related to this evening's webinar, and we'll try to get to those, and some unfortunately are not. And we'll do our best to get to all the questions. Before we begin, I just want to give a disclaimer. Number one, this webinar is being recorded. The information provided during the webinar does not constitute specific legal advice to you or your child's circumstances and should not be relied upon as such. The webinar does not establish an attorney-client relationship with myself, attorney Lawrence Berliner, nor does it establish a psychologist-patient relationship between Dr. Kruger and yourself, or Jane Faherty and the Jewish Community Center Jumpstart program and yourself. By signing up for this webinar, you've agreed to receive information about future webinars and events from either the Stamford Jewish Community Center and the Law Office of Lawrence Berliner. Please note that this recording is through Zoom, a third-party provider, and is not an agent or associated with the Stamford Jewish Community Center, Dr. Robert Kruger, the Law Office of Lawrence Berliner. We have people coming from not only other states, but other countries, which amazes me. It's truly a worldwide web, but all of us are focused on the state of Connecticut. So that's where I'm licensed to practice. I know Dr. Kruger is licensed in both New York and Connecticut. So our focus is primarily Connecticut. So I know we had some questions about what to do in other states. It's hard to keep up with what's going on here in Connecticut, let alone developments in other states. We'll do our best. We would prefer that you use the Q&A format at the bottom of your computer and not the chat. The reason being, this is being recorded, and what's in the chat is recorded, whereas the Q&A is not. So if we're in an effort to try to preserve your privacy and your confidentiality, we prefer the Q&A format at the bottom of your computer. We prefer that your questions be as general as possible in nature. So everybody who's participating, and we have quite a few people participating. We have parents, educators, I think an attorney or two, many other people who are on, and we'd like to have the questions as broad as possible so it can be, the answers can be disseminated as much as possible. I have mentioned two things in the past. One, be on the lookout for the new IEP forms that will be in effect for the 22-23 school year, starting in July. So you might want to look on the State Department of Education website, which I might add is on the chat. All of our contact information, the State Department of Education website, and the US Department of Education website is all in the chat. For those who want a copy of this webinar, if you've signed up, you'll receive a copy shortly after tonight's webinar. So I'll let Jane introduce herself, and then we'll get to Dr. Kruger.
Hi, I'm Jane. I wear a number of different hats. One of them is I oversee a program called Jumpstart at the Stamford Community Center, where we support children with developmental disabilities, primarily aged between 2 and 3. I then help those children transition into the public school as an advocate and continue to support the families up through the grades. So I'm currently supporting some families in middle school now and preparing them to transition actually into high school. So I've been doing this for a little while at this point. I'm also a parent, so I understand a parent's perspective and the challenges of supporting your child, providing them with a voice, and using your own voice through the system as well. And I work with a number of different organisations to create partnerships within the community to support parents, children, educators in the realm of education, and in particular special education. So it's lovely to be here again tonight. Thank you, Lawrence, and thank you, Dr. Kruger, for returning. I know that I'm sure Lawrence can talk to this as well. More recently, there's been a lot of conversation, a lot of questions from parents regarding IEEs and wanting to understand what IEEs are and the process and the evaluations and so on. So it's lovely to have you here tonight to join us, to shed some light on this subject and just to share your vast knowledge with the audience. So thank you, Dr. Kruger.
Thank you.
Thank you. So we're going to be focusing on the evaluation process, demystifying the independent evaluation process. That's part of the federal special education law. We have state guidelines here in Connecticut on independent evaluations. And just to recap, this is our second year of hosting these webinars. I'm surprised that so much time has gone by, and we are continuing to present them because we're part of a community of concerned parents, professionals, and we're all still learning how to connect in order to get through these difficult times together. I thought a year ago that we would predict a year later that this COVID-19 health emergency would be over, but here we are a year later, still dealing with the aftermath of this never-ending pandemic. So we've tried to put together webinars to address the impact on your child's special education journey. And we've, again, convened tonight to address questions, frustrations, and hopefully hear some successes and to empower people in the road ahead. Dr. Kruger, I've had the pleasure of knowing for all too many years, most of my career, is a licensed clinical psychologist, both in New York State and in Connecticut. He has a practice located in Westport, Connecticut. He's a graduate of Haverford College, Columbia University, and Yale University, where he has a PhD in clinical psychology. He's had employment all over the universe, it seems, at Columbia University, Yale University, Long Island University, Norwalk Hospital, Cornell University. This is an interesting one. He was a consultant to the Southern Connecticut, Southern New England Telephone Company. Everybody remembers SNET. He's part of the adjunct faculty at Norwalk Hospital, and of course, he's in a private practice. He's a member of the American Psychological Association, the Connecticut Psychological Association, the National Academy of Neuropsychology, the International Neuropsychological Society, and a member of the Association of Advancement of Philosophy and Psychiatry. He has published all too many articles. I've known Dr. Kruger primarily through all the evaluations he has completed for clients and families that I represent, participating in PPT meetings, due process hearings, state agency hearings. And without further ado, we'd like to turn this over to Dr. Kruger to go over his background if I left something out in my brief summary, and to talk about evaluations from a psychologist perspective.
Thank you. No, I think you covered the ground of my background pretty well. So I guess the question that arose was independent educational evaluations. And maybe we can just talk about evaluations in general. Independent means that the person performing the evaluation is not particularly biased one way or the other. All evaluators should actually aspire to being independent. But I think because sometimes parents find themselves in an adversarial situation with school districts, the idea of someone outside the district who does not work for them to perform an evaluation becomes attractive. So the question is, what is it that we're evaluating? Well, like all things in clinical practice, it's usually something that someone is feeling is problematic. People don't go to the doctor because they feel well. They go to the doctor because they have a symptom. And depending on the symptom, the nature of the consultation varies. Same thing with psychologists, with school psychologists, and the same thing with educators, although I don't think they think of themselves as being members of a clinical profession, but they actually are. The expectations that we all have of children are based to some degree on our own experiences and on what educators communicate to us about what is expected. So our sense of what a child should be able to do at a given age depends to some degree on what teachers tell parents is expected and what they think is realistic. And so parents also have a general idea based on their own experience of what's realistic. So for example, if a child is 7 years old, let's say, and in second grade, and they are unable to read much beyond a word or two, most of us would say there's something wrong. There's a problem there. If they hear from the school district that the child is delayed and they will catch up, and or that the child's too young to evaluate, then I think most parents say that doesn't make sense to me. You know, my child is 7 years old and everybody in their class reads and they don't read. That's what my child doesn't read. There's something wrong here. So that's where people like myself may get involved. Sometimes it's not. Sometimes the case is a little more diffuse and ambiguous. So it might not be a 7-year-old. Let's say it's a 6-year-old in first grade, about this time of the year in first grade. And the child, let's say, knows most of the alphabet, but not all of it, can tell you the sounds for most of the letters, but not all of them, and can read a few words, but not too many. And let's say, for the sake of argument, that the child was born in, let's say, March or February, so that they're not really 6, they're 6 and about, perhaps 8 or 9 months. So they're almost 7. And they will be 7 within a few months in first grade. Again, a lot of parents will say, I think there's something wrong here. I think this is really problematic. What's going on? And if they hear from the teacher, well, you know, he's just delayed, or he's making progress and he'll catch up, then I think most parents would say, I don't believe that. I think, why isn't he reading the way everybody else reads? This is just a very simple example, but it gives you an idea about why sometimes parents will request an independent evaluation. Usually that involves going through the PPT process and requesting an IEP and perhaps being turned down for an IEP. You know, Attorney Berliner can speak more to this. I mean, at one point, if a child wasn't reading and they were in first or second grade, they would, in fact, usually end up in special education. These days, that doesn't happen. We have literacy specialists, and they're considered part of regular education. And I assume that has something to do with the State Department of Education making a decision about that, because all the districts do it. So a child is given what they call literacy intervention. The main difference between that and special education, as I understand it, is that literacy intervention is what you might call at-will intervention. It's up to the district to decide how much intervention, how often, and they can start and stop it at will. They don't have to inform parents that they're doing it, although they should, and they can stop it. Now, if I'm incorrect in that, that's been my experience. If parents have told me my child was getting literacy intervention, and I just found out 2 months ago they stopped it. Nobody said anything to me, and he's not reading. I always found this surprising, but I gather that can happen. Whereas if you're in special education, that doesn't happen, or it's not supposed to happen. It can't happen really under federal law. If the child has an IEP, the IEP needs to be followed. It wouldn't stop a district from not following it, but there are complications there that I don't think most districts want to get involved with. So I think to go back to my original point, psychological evaluations of any kind get requested by parents usually, and perhaps sometimes being authorized or referred by a pediatrician, thinking there's something wrong with their child, that their child is not doing something that's developmentally appropriate at the particular age that the child is. Now, one might ask, where do these general norms come from? How do we know what children should be able to do or not do? Well, that's a really good question, because that's sort of where IQ tests got started. Originally, the idea was that we do have a general idea at different ages of what children can do. And if they can do them, then they're pretty typical. If they can do a great deal more than what they can do, than what other children can do at that age, then we think of them as bright. And if they can't do what children that age can do, we think of them as behind or delayed. And that was really the idea behind IQ tests in the first place. But there are now many more kinds of tests besides IQ tests that can be used to take a look and shine a light on what a child's able to do. The norms are generally those that are developed in a few different ways, sometimes epidemiologically, sometimes by the companies that produce tests. And to do that, they do rely on academic and professional experts to tell them what should a child of 6 years and 4 months be able to do with regard to, let's say, reading, what would be typical, what's normative. Now, this is where we get into the whole question of statistics. And I think this is where districts don't do a good job. So most states, Connecticut included, have standardized testing that's required of children at different ages. And that's administered by the district. I think, I could be wrong, but I think it's paid for by the state. Then parents get a nice printout with scores. And the score might say 248. But nobody says, what does 248 mean? What is that? How do I interpret that number? Is that good or bad? Sometimes in some districts, they do include percentiles. What is the percentile? Well, a percentile can vary. So percentile is a little bit like a percentage, but not quite. All testing, whether it's educational or even medical testing. Let's say you went into the doctor and he wanted to find out what your blood sugar was, what your glucose level was, you get a number back. And the number usually has next to it whether it's in the range or not. Now, the point is that all testing, whether it's medical or educational, is based on an underlying assumption. That is, if you measure enough individuals, you get a distribution that looks like a bell curve. Bell curves are sort of like this. You know, there's two ends, which kind of tail off, and a big bulge in the middle. If you haven't seen one, it's worthwhile taking a look at Wikipedia and seeing what it looks like. And what the bell curve represents is, imagine you could test everybody in a particular age group. Let's say all 6.5-year-olds. That is from 6 years, 5 months to 6 years, 7 months in the United States. And let's say there may be 4 million of them. And if you tested them all on a given task, let's say, how many words can you read? Real words. You would find that there was a bell curve distribution. And that's just, if you think of it like a bar graph where you're going to chart how many kids can read how many words, and the height of the curve is how many. And along here you have few or none up to many. You're going to see that it will be a bell curve. Now, what's the percentile? So the percentile is, let's say your child is right in the middle. okay, of that line going from none to many. All right, you would see that if you drew a line straight up to the top of the curve and took this half of it, this chunk, as a percentage of the total number of people, it would be about 50%. So because it's 50%, we say your child's in the 50th percentile. What does that mean? It means that they did better than 50%, but not as well as the other 50%. Why 50 and 50? Because 100% is all you got. It's only 100% the total population. It's pretty much the same way that college boards are scored. Or for those of you in the Midwest, the American College Test. Now, normally with a college board, we'll say, okay, scores can go from 200 to 800 on any given test. But that's really just the number the college board gives it. You will see there's also a percentile given. The percentile tells you where is the child. How much better did they do than everybody else? Well, of course, the higher your number, the better your percentile. And that's really what the standardized testing that the state does equates to. Now, the question is, what's the reference point? Now, what I've said just a little while ago is imagine all 6.5-year-olds. Well, here is where we get into a question, because unfortunately in our country, we have great inequities in education, in economics, in wealth. And so school districts are not equivalent, even in the state of Connecticut. So for instance, if a child attends school in one of the city schools in Bridgeport or in some parts of Hartford, the average score there on a reading test will be much lower than the average score in the town I live in, Westport, or Darien, or Guilford, where Attorney Berliner resides. So it depends. The tests, though, interestingly enough, I think for the state are based on what they estimate is the average for the state. Now, it could be the national average, because that's the kind of testing a psychologist will do. They will use a test, for example, like the Wechsler Individual Achievement Test, 4th edition, published by a company called Pearson. And the norms there are based on national averages. So we might find a child, for instance, who lives in Darien, Connecticut, who is scoring in the 21st percentile in reading on a national average. And the school district is saying that's normal, that's average. And the parents think that's ridiculous, my child can't read. Well, here's, of course, what you have to understand, that in Darien, the mean, let's say, for reading on a national basis might be on one of these tests about the 75th percentile. I'm not saying I know that's what it is, I'm just estimating, but it's way above the 50th percentile. And so therefore, being in the 21st percentile nationally, even though Pearson says that's within the average range. And what do they think the average range is? It's pretty simple. In statistical terms, it's what's called the standard deviation above or below the mean, meaning from the 16th percentile, that's the bottom 16% of the population, up to the 84th percentile. So the 21st percentile is in that range, right? Okay, but if you live in Darien and you read in the 21st percentile, believe me, you're going to be a problem reader. You are not going to be where you are. And this is sometimes why parents feel that school districts don't listen to them, because they're saying, well, the company that we use, whose test we use, says that's average. They may say it's average, but it's not average for your district. When that argument is brought up, districts say, well, we're not obligated to use district norms, we use national norms. And that, unfortunately, is where a lot of the inequity comes in, and that's where, unfortunately, then parents end up being very unhappy and frustrated because they feel that nobody is paying attention.
If I could just interrupt on that last point, Dr. Kruger, what parents feel is very, very important, and that's not going to show up on a percentile or another score. And I always tell parents to trust their instincts, and parents always are making comparisons to siblings, next door neighbors, the cousins, or whatever. So if the parents feel something is not right, act on those instincts. That's all I wanted to add.
Absolutely. I couldn't agree with you
The other
more.
thing I was going to say too is that if the parent knows that their child is underperforming within their child's school, their child's school district, as well as the state, because some schools, I know mine, for example, my children always told me where my students were in regard to their peers in the grade, their peers in the district, and their peers in the state. A parent might know that their child is underperforming, and the school district might say, but they're fine, we're not overly concerned. What the parents need to know is, what is the reason behind the underperformance? And that's where you and the other professionals giving the evaluations can really provide insight and help the school district then provide the appropriate education to support that developmental need to understand, why is the children not grasping the concept to read? Why is a child struggling when it comes to numeracy or literacy? And it's the deep dive that you can do as a professional, which sometimes the school districts neglect to do, which, as Lawrence would know, means then the education that is being delivered is not appropriate. So it is not therefore in compliance with FAPE. And that really is one of the parents' concerns, is that they ask for IEEs, or they're told that your child is okay, they're not an A student, but a C is fine, a D is fine. But it doesn't help the parents understand what really is going on with their child's learning needs and what's causing them to struggle with a particular curriculum or the way in which information is presented. And I think that's the true value of an IEE, is the insight you can provide not only for the parents, but for the professional team in the school, so they can really come together and brainstorm and come up with different strategies, maybe different reading programs, mathematical programs, and techniques that can apply to make it appropriate, which, you know, is what Lawrence and I do as advocates and attorneys, to make sure the education, as well as being free, is appropriate.
That's exactly right. I think that's exactly right. And I think this all does go back to parents trusting their instincts about a child. The difficulty is, unfortunately, that we don't necessarily have here in Connecticut good educational material provided to parents. So at the beginning of school, it seems to me one thing districts could do is to have informational meetings with parents at the beginning of each academic year for each grade, to say, your child is entering kindergarten. What should they be able to do at 3 months, 6 months, and at the end of the year? And the same for first grade, second grade, so that parents have a rough idea of what it is the district is expecting. That information is not provided or shared. And parents then don't really know whether a child is having trouble or not having trouble. They can't make an independent decision about it. And sometimes they're very shocked to learn about April that the teacher is saying your child should be retained. They should repeat first grade because they're not making progress. Now, if parents knew what to expect, they might have a better sense of what kind of progress the district is looking for. So I think that that kind of information is something districts can do that actually would, I think, reduce the amount of adversarial interaction they have with parents. If parents knew this is what districts are, this is what my district is looking for, this is what they're expecting, they could then say, okay, well, it's the 6-month point here in first grade, and my child is missing all the benchmarks you've mentioned. We should have a meeting and talk about this. That, I think, would be very helpful. But I don't think that's something districts have ever acted on, and I've never heard anyone propose it. So I think it's something that could be done pretty easily without a lot of extra effort on the part of the districts.
So this is a question to both Lawrence and to you, Dr. Kruger. If a parent has a concern with regard to their child's academic performance, they can see that maybe there's regression, that they're not, that the developmental academic gap between them and a peer within their grade is widening or has not decreased over a period of time. Lawrence, to you and also to Dr. Kruger, how does a parent go about asking and requesting specific tests to really identify what's going on with their child's ability to access a curriculum. Dr. Kruger, there are specific tests that parents should ask for district to perform. And Lawrence, at what point should a parent ask for those evaluations to be completed? And how do you bring that up in a conversation?
Well, there are multiple measures of progress, and this is, if you're not seeing progress, then it's either flat or worse, it's regression. And so when parents aren't seeing their child meet expectations for, say, a second or third grader, they should be, if there hasn't been an evaluation, they should be asking for a comprehensive evaluation of all areas of the child's suspected disability. The suspected disability simply means that they hasn't been formally evaluated by a school district. And if they have a private evaluation from somebody like Dr. Kruger, they should share that with the school district. One of the questions we had tonight, are there any specific tests that parents can request? The answer is yes, but which one? In the old days, when they used to publish a directory of standardized assessments, it was almost like a Manhattan, telephone directory. That's how large it was. I'm sure it's online now, but there were so many tests, and you'll see certain tests that will show up again and again and again, but there are many others besides. Dr. Kruger mentioned the Wyatt 4. Well, there's a Woodcock-Johnson, and there's a Key Math, and there's a Gray Oral Reading, and there's a Stamford-Binet. There are all these tests out there. So I know some psychologists in particular have a preference for certain testing, or certain tests, I should say, and they go with those. And sometimes testing begets more testing. But to get back to your question, Jane, if the parents suspect their child has a disability that's affecting their education, and it's not just limited to the so-called 3 R's, reading, writing, arithmetic. It could be social, it could be emotional, it could be physical, it could be many other areas, request an evaluation. Where the independent evaluation comes in, this is an IEE, an independent educational evaluation. If a parent disagrees with a school district evaluation, they can request a publicly funded independent evaluation. Or if they have good health insurance or money is no object, they can obtain their own private independent evaluation. But when the parents ask the school to fund an independent evaluation, the school district has two choices. They can say yes, and they can say no. If they say yes, they will pay for the evaluation, provided the evaluator meets their criteria. So it's important to have the independent evaluation criteria of your local school district. Some have geographic limitations, some have financial limitations, some have the types of qualifications an independent evaluator has to have. So you want to make sure that the private evaluator that you have selected meets those criteria. One of the questions we had tonight is how do you find an independent evaluator? The school district can suggest, but not compel, that you consider evaluators that are on their list. And if you don't know anybody to do, say, a psychological evaluation, an audiological evaluation, a speech evaluation, that would be a good starting point. Another source is a pediatrician. All parents have a pediatrician in tow, so maybe the pediatrician would be a good referral source. Or if you're involved with me or Jane, we have our stable of evaluators, and I try to make a referral to 3 or 4 and let the parents make their own choice. All of them are independent. As Dr. Kruger pointed out, they should not be biased. They should be focused on the child. If the school says no to the independent evaluation requested by the parents, they have to request a due process hearing, which is a formal hearing to defend their evaluation. And many school districts are very contentious, and they will always fight a request for an independent evaluation. And other school districts are more collaborative, and sometimes instead of having your evaluator, we agree on what's called a mutually agreed upon evaluator. In other words, you provide 3 names, they provide 3 names. If one of those names is on both lists, that's the mutually agreed upon evaluator. Now, the State Department of Education, ct.gov is the state website. It's on our chat. Has a publication that came out in 2018 on guidelines for independent evaluations. It's a pretty comprehensive document. It's a good referral source as far as what your rights are, what the school district's obligations are, and in an effort to try to work in a cooperative process to try to avoid a due process hearing. When a school district pays for an independent evaluation, the PPT, the pupil planning team meeting, has to consider it. That doesn't mean the results are binding on the parents or the school district, but the PPT, which includes the parent, will consider it. And that is the procedural process of getting an independent evaluation. Disagree with the school district evaluation, request an independent evaluation. Find the independent evaluator, review it at a PPT meeting. There has been some confusion because in the federal regulations, parents are entitled to 1 independent evaluation per year. Some school districts have interpreted that you get 1 evaluation period. The way I interpret it, if you disagree with the psychological, you get your 1 psychological. If you disagree with the speech and language evaluation, you get your 1 speech and language evaluation. Doesn't mean you have to pick amongst 6 evaluations and you only get 1. So it's very important to understand your rights. And that's what this 2018 guideline from the State Department of Education tries to explain.
So Dr. Kruger, how do you as a psychologist in your role, when you meet with a parent and you're trying to figure it out, how do you decide which tool you're going to use to evaluate the child?
That's a great question, Jane. I think the answer to that is the same way I would decide if a parent came to me about any problem. It's really, what is the parent telling me about the child? What is their estimation of the child's ability? What can the child do or not do? And then what has the teacher said to the parent about the child? Has the parent asked the teacher about the child's progress? What has the teacher reported? Sometimes I'll read report cards, and sometimes I'll talk to a teacher myself, with the parent's permission, of course, and ask what the child is doing or not doing and how much difficulty are they having. If it's not a behavioral problem, then generally speaking, that's a good place to start. And in terms of the evaluation, then what I want to do is try and separate out any, let's say, cognitive factors that might be responsible for the child's difficulties, educational delays or failure to progress, other things like attention, memory, language skills, and so on. And every child's evaluation in my practice is unique. They're not all the same. It depends a lot on what people are asking me to look at and what they think the problem is. Now, I may discover something else that they haven't asked about, in which case, of course, I would share that. But usually, it also depends to some degree on the age of the child and how old the child is and what the parent thinks the child should be doing. Sometimes, very occasionally, parents have unrealistic expectations, maybe because the child is the youngest of 3 and the other 2 did something at a certain age and this child's not, but it could be that the other 2 were, prodigies of one sort or another, so that what they did was not to be expected of a normal child. So I think a lot depends on the history. And that's why I always tell parents I don't see children without talking with parents first and getting a history. and finding out what's this child doing? What were they like when they were infants? What were they like as young children? What are they like now? And then what are the other children in the family like? And then what about the rest of the family? The parents, their brothers and sisters, their nieces and nephews. Is there anyone else in the family like the child, and what's happened to them? So based on that, then I can come to some sort of tentative conclusion about what kind of testing I might want to do, which I then share with the parents and explain to them, here's what I'm planning to do. Is this okay? I'm going to be doing this test and this kind of a test and this kind of a test. And then that should give us an idea about where we are. Again, it's very similar to what might happen if you go to your doctor's office and say, you know, I have this pain here. And your doctor says, well, it may be that, it may be something else, it may be referred pain. I'm going to do some tests. And you assume that the tests are to help the doctor sort out what the source of the difficulty is. And it's the same with psychoeducational testing. We're trying to sort out what the problem is.
The other question, Dr. Kruger, this comes up quite often. The question is, what happens if a school denies the neuropsychological evaluations? Are there valid reasons? But the question I think needs to be asked before that, what are the differences between what I'll call a plain vanilla psychological evaluation and a neuropsychological evaluation? Because sometimes parents need a neuropsychological evaluation for their child and sometimes they don't. Can you possibly address that?
I think it depends a lot on what's included and who's doing it. So there is a specialty within psychology called neuropsychology. Clinical neuropsychology are people who do testing and evaluations, and they work with all ages, but there are pediatric neuropsychologists who work with children. And then there are people who work with adults, and they often work with people who had brain injuries or a variety of other kinds of conditions that compromise brain function. They have a particular kind of testing or training, usually, very careful supervision of cases. And they may take certain courses, but typically a psychological evaluation can include the same testing as a neuropsychological evaluation, depending on who's administering it. So some people don't say it's a neuropsychological evaluation if they haven't had that training. It doesn't mean it's any less valid or relevant. I think the point is, how comprehensive is it? What does it cover? And how far does it go? When I test a child, I'm looking at particular areas of functioning that reflect what the child is able to do, that is what their brain is able to do. I'm not evaluating, for example, their gait, how well they can walk. I would send somebody to a physical therapist for that. I'm not evaluating their grip strength. I might send them to an occupational therapist for that. If a child has a compromising medical condition, that's also not my purview. What I'm interested in is, from a cognitive standpoint, intellectually, where is the child compared to everybody else? Academically, where are they compared to other people? What is, to get into more, general brain function, what's their attention and memory like? What's their ability to plan and be organized like? How well do they understand what people say to them? How well can they draw an inference or a conclusion? Those are the kinds of things that I'm looking at. So I wouldn't hang too much on whether it's a psychological or neuropsychological evaluation. I've seen very good evaluators who call their evaluations different things, but what matters is what's the content of the evaluation, how thorough is it? And I've also seen school evaluators do very thorough evaluations too. Not that the schools don't do them, some people do. They do an extremely good job. I think the issue is what do the people who make the decisions do with the data? That's really the concern. It's not the test. I mean, it's possible for somebody not to test something and to miss it. That doesn't usually happen. The discussions and disagreements I often have with districts have more to do with, well, here are the numbers, and I view it this way. What do you, and then they say, no, we don't think there's something wrong there. So that's really more the issue. It's the interpretation. And that's often when parents feel that they're not being heard. You know, to go back to my example about the 21st percentile in reading.
I think it's also really important as well, the expectation. We spoke about expectation at the beginning in terms of expectation as a parent, expectations as an educator, school district, a state, or the bigger picture. It's really important that when you do have an evaluation, you understand that information that you're reading as a parent. And if your child, for example, presents with a low IQ, that doesn't mean that you should lower your educational expectation
Not
of
at all.
your child. And it's also important that if a school district does an evaluation and the results don't come in as high as you might have thought, or you're concerned about that, you need to hold the school district accountable for maintaining a high expectation of your child during their educational career. So Dr.
That's
Kruger,
exactly
do you
right.
have any ways or conversation as to how to support a parent have that dialogue with a district? And when you're doing an evaluation, what advice do you have for parents to get the support so they understand the content of the evaluation? Because quite often they get them, but they don't necessarily understand what they're reading.
Yeah, well, I'll just make 2 points. First one is children can test with low IQs for lots of reasons. One of my favorite example is a child who wouldn't do the testing with the school district, so the psychologist who scored it just gave her zeros because she refused to do it. So she came out with a very low IQ. And in fact, when I tested her, it was pretty hard to get her to cooperate. And part of the reason was she had a very, very short attention span. She didn't really want to be doing this and not interested. So if, you know, I was able finally to engage her for short periods of time. So I had to change the way I usually test kids and just test her over very short intervals. And then we were able to see, well, actually her IQ wasn't that low. She just really didn't pay attention, couldn't concentrate, wasn't interested. So that's different than having low IQ. That means you're not cooperative with the educational process. But secondly, I think that when I do an evaluation, I spend a fair amount of time writing a report, but then I also spend a fair amount of time going over the evaluation with parents, and if the child is old enough, with the child, and explaining the whole concept of what is normative, how that's arrived at, what the statistics and numbers mean, how to read the report. So if they get another report from another evaluator, they can look at that and they know what it means. And they can tell, okay, this is good, this is not good, this is up to par, this isn't up to par. And I really look at those feedback sessions with parents as educational opportunities. And that's a very important part of any psychologist's job. If you don't do that, then it doesn't matter how thorough your evaluation is. It doesn't help, because if the parents don't understand the data and what they're getting, they just know you said, well, they have a problem reading. That's not useful. Parents want to know how much of a problem and how do I assess that? So I think that's very much the evaluator's job.
And someone such as yourself, so I was just going to say, someone such as yourself could also help educate and inform the school district personnel as to what the content of your evaluation means, because I have been at PPT meetings where you would assume that the people around the table working in the district might understand the content of an evaluation, how to apply it appropriately, but that isn't necessarily always the case. So there is a value to having someone such as you participate in a PPT meeting to share your insight and suggestions and knowledge too.
And I just wanted to add to that, the recommendations, often I find the recommendations in the private evaluations are very specific, and the recommendations in the school district evaluations are very general. the recommendations will be discussed at a PBT meeting as opposed to reading 4 times a week for a half hour with a specific methodology. To me, makes a hill of beans difference when I'm trying to assist a family. And this is where I would prefer school district to be more detailed with their recommendations, as the private evaluators are typically detailed with their recommendations. And we've had several comments in the chat section about being frustrated and it's challenging. The only thing I can say is, on a day-to-day basis, unless parents are monitoring their child progress, how they're doing in school, how they're doing at home with school-related issues like homework, or they come home from school with a meltdown, don't give up. This is your responsibility. Unfortunately, I always say parents would like to send their child off to school in the morning and get them back at the end of the day a little smarter and a little happier. And probably for a majority of students, that's a fair statement. But when you have a child who's struggling in school, you can't assume. You need to fight the fight. You need to advocate for your child. You need to ask the questions that need to be asked. And you need the answers to help you better understand your child's learning challenges and whether they are in fact making progress in school. Because often what I find, and Jane, I don't know what your experience is, I often find the transition from about 3rd to 4th grade is a very critical point in a child's life, where we've gone from learning how to read to reading to learn. And that transition assumes that they have all the basic foundational skills and they're ready to apply it and be more independent from 4th grade until the end of their academic career. And often that's where the difficulties lie. And one of the questions we had was, if the school district is using classroom performance as their data, is that enough? And I would say, no, that's only one measure. The other measure is certainly parents, and other measures are the results of standardized testing and statewide testing, like the SBAC or the STAR testing or the Ames Web or DIBELS, which are curriculum-based testing. Yeah. There's all kinds of measures, but the most important starting point for me is what the parents believe, they feel, what they see, particularly at home.
Yeah, and it is around that age, for example, the reading becomes prevalent, particularly when you look at mathematics, because at that point, the math are problems that they have to read. So not only are they having to decode a math problem, they have to comprehend and understand what they're being asked to solve as well as a problem. But one of the questions we were asked, Dr. Kruger, is, what is the difference between a medical evaluation and an educational evaluation?
Medical evaluation of a child?
I'm assuming of a child, yeah. Is there a difference between a medical evaluation and an educational evaluation?
Oh, sure. Well, a medical evaluation, I'm assuming, is done by a medical practitioner, whether they're a physician or a nurse practitioner or a PA, physician's assistant. And that's really looking at the child's physical functioning. So they mostly do, if you think about your, annual evaluation or examination by your pediatrician, that's a medical evaluation. So they're looking at things like heart rate, blood pressure, your eyes, your ears, and whether there are any medical conditions that might be compromising function that are chronic. If a child unfortunately might have something like diabetes, what does that mean? That's a medical evaluation. An educational evaluation is looking really at a very limited segment of what children can do, even though school takes up a big part of their time. Their educational performance and abilities are really only a very small part of their functioning, are really things that they will learn and use later in life, but really to somewhat of a limited degree. In fact, if you think about it, apart from those of us involved in this kind of work, yourself, Attorney Berliner, myself, other people, teachers, most people graduate high school or college or graduate school and they go to work. And what they do at work is not really what we would think of as educationally based. I mean, they may have to read some, but sometimes they don't have to do very much reading. They may have to understand mathematics, but sometimes they don't. And their success at work actually isn't based on what kind of student they were. Their success at work is really based more on what kind of person they are, you know. And many children go through school having been very lackluster students, but very successful in life. And from the standpoint of what they achieve. So I think it's important for people to remember that school is important, especially as a child and as an adolescent and as a young adult, because that's what you're doing most of the time. But it isn't what you're going to be doing for the rest of your life. You just want to be able to do it well enough that it isn't a problem. And that's where we come in.
Now, this is just a fun, interesting fact. So there's something called the Fogg Index, which has been used in the UK to determine what level, reading grade level, for example, printed newspapers are. So the Fogg Index, if you're reading the equivalent of the New York Post, has a reading age equivalent of an 8-year-old versus, let's say something like the New York Times would have a reading equivalent of a 14-year-old. So it's
That's
quite
right.
interesting to me that as adults, we are reading prints and publications, for example, in the news, which are geared towards somebody that's age 8 or potentially somebody age 14. But as parents and educators, we obviously want our 18, 19, 22-year-olds to graduate reading at a much higher level than, as you were pointing out, Dr. Kruger, when you're in the real world, our expectation somewhat diminishes when it comes to reading general publications. So I just thought that was fascinating. I found that out the other day. But again, it goes back to expectation. We should always have a high expectation of educators delivering the highest level of education for our children as possible, and to hold them accountable to delivering that standard consistently year after year, semester after semester, and quarter after quarter. And that's where the importance of tracking the data, keeping examples of work that your child is bringing home. You could also request, some children use journals or workbooks at school, request to have copies of, if the school district keeps that in the school classroom over the weekend, ask them to give you copies of the pages that have been completed that week so that you can track your child's progress and actually see what they're learning at school. Because sometimes you assume they're learning one thing, but they're not.
I think that's an excellent point. I think that's an excellent point, Jane. Actually, one of the best pieces of advice I can give parents is make the teacher your best friend. Find out what the curriculum is. What are they teaching? What are they asking your child to do? What's expected? And each week, then track your child's progress, and don't be afraid to send the teacher an email or even call them and say, what are you covering in school this week? I'd like to help my child master the material at home and do some work at home. What is it that you're doing? There are standardized curricula that teachers follow, and they should be able to give that information pretty easily to parents.
I would also ask the follow-up question, if you see that you're receiving the information from your children at the end of the week. Some weeks you see them more successful at the joint attention, mastering or understanding the content, and other weeks they're not. And they're being taught by different teachers for different subjects. I would ask the question about how are you teaching this subject? Some teachers might be more tactile, hands-on, allow movement breaks. They might be more kinetic learning styles in their classrooms versus others. So it's also important and okay to ask the teacher about their teaching style, because you might find there's a trend and your child learns better in some environments versus others. And as Lawrence knows, that's where at the PPT meetings, we can talk about the appropriate education and embedding those different learning styles and techniques that your child needs to meet their individual needs and make sure it's consistent in the different classes that they're attending.
That's
think
an
that's right.
excellent point. I mean, the one size fits all is not the approach when you have a child with an IEP. It has to be customized based upon the child's unique needs, not what's available in the building or the district. We had a question before the webinar. What are the evaluation rights when a child's in a private school setting? This is very interesting. In 2004, the federal special education law was amended, and there was this odd provision. No one really knows where it came from, but it basically answers this question. If you, let's say you live in Fairfield and your child goes to a private school, say in Stamford, the location of the private school is responsible for completing an evaluation of your child's suspected or actual disability. But in my example, Stamford Public Schools is not responsible for an IEP. They're responsible for providing what's called a services plan. So what a parent would do is take the Stamford evaluation back to their home district, Fairfield in my example, and they would ask for a PPT meeting to determine whether Fairfield would develop an IEP. So if your child attends a private school, they have a right to an evaluation. If you live in Fairfield and your child goes to a private school in Fairfield, Fairfield Public Schools, in my example, would be responsible. But if they go to a private school located in a different locale, then that town or city would be responsible for completing the evaluation. Unfortunately, you do not have a right to an independent evaluation if you disagree with that type of evaluation. You only have a right to an independent evaluation if you disagree with your local school district's evaluation. So I hope that answers that person's question.
But if a parent had the means, that wouldn't prevent a parent from privately going to get a second evaluation, just to give them a reference point by which to share with educators in the private school setting, correct?
I'm sorry, what was that?
I was going to say that if a parent disagrees with the public school's evaluation and the parent has the means, they can always get their own private evaluation.
That's
and
correct.
They can then share that information with the team. Even if the team disagrees with the content, they can still share it, and someone like Dr. Kruger can still be used as a resource to give suggestions on how to make the curriculum more appropriate and accessible to that student.
Right, and that becomes your baseline data from an evaluation point of view. So against that baseline, you can judge future progress. The reason I was focusing on one of the questions was about, we've had a couple of questions both before and tonight about twice exceptional students. Do districts have any motivation to investigate if a child is gifted and talented? Maybe the question was compensating for a disability. And then there was another question, you know, are there any kind of special evaluations for children who are twice exceptional? I don't know if Dr. Kruger can handle that, or Jane.
Sure, I'm happy to talk to that. Actually, this comes up quite a bit, interestingly enough, in evaluating children who might be considered on the autism spectrum. Some of them are quite gifted, and they may show up as gifted, but not behave the way other children behave. And so the issue then becomes one of how is the district going to address this particular dilemma? If you have a child who is, let's say, in first grade and reading at sixth grade level, and they are a whiz at math, but their social behavior is a little bit peculiar, and they've been evaluated by someone like myself or someone else who says, well, this child is actually on the autism spectrum. The district is obligated to address both issues. They have to address how gifted the child is, and that they have to provide an appropriate education, but they also have to address the medical condition, the autism, and provide services for that. And then try and find a way to manage both. That's often quite a handful for most districts, but it can be done.
Yeah, and then just another question that we received was somebody asked, where can they get financial support or funds to pay for an advocate or pay for a special education attorney? There is an organization called SELF, which is called the Special Education Legal Fund. If you can go to, they have Facebook pages, Instagram, a website. So if you go to SELF, there's an application form that you can complete and submit, and they will give some financial support. I think it's on a sliding scale, but I could be wrong, to families to help pay for the cost of hiring an educational advocate or special education attorney, such as Lawrence.
That's a good referral source. And when you type in SELF, make sure you put in Connecticut, because you'll be all over the internet.
Yes, sorry.
So make sure it's Special Education Legal Fund, or at least SELF Connecticut. Otherwise, you'll be elsewhere. We had an interesting question come in this evening. A child had a neuropsychological evaluation, it looks like, with a full scale IQ score of 91, average to low average index scores elsewhere. I guess this is a WISC 5. And the parent is wondering how to advocate for their child to take into account the variabilities, meaning the strengths and the weaknesses, the average scores and the below average scores. Is there any strategy or technique that that would be recommended when we have, say, an uneven profile, some scores average, some scores below average? Well,
I guess the question would be, is the child having difficulty? I mean, just a score, an IQ score of 91 is still within their normal range. It's in the 27th percentile. The question is the child having a problem? Are they doing okay in school? Are they reading? Are they writing? Sometimes that indicates a particular problem. So, for example, in my clinical experience, what I've found is that lower IQ scores may be due because they are ranges and they assess, there are many components to an IQ. So on the Wechsler 5, there are 5 different domains that get measured, and they contribute unevenly to the IQ. So the question is everything low, or is that an overall picture, or are there strengths and weaknesses? So, for example, many years ago, when there were not so many domains, there used to be what were called verbal and performance tests. And it was not uncommon to find children who nowadays probably would be assessed as being on the autism spectrum as being very high in one and low in the other, and overall somewhat lower. So, for example, they might have a very high verbal IQ of, say, 120 or 130, and have a performance IQ in the 70s, and then average out maybe in the 90s. And then the question is, does that mean they have a low IQ? Well, if you talk to them, they don't. They're very articulate, but they're also not very good manually or in terms of any kind of eye-hand coordination. They may be very poor at that. So the question is, why is the IQ number 91? What else is there? What are the other scores? Now, some children do worse on IQ tests because they involve following directions. And they may have a language processing disorder. If I see, for example, a child with an IQ of 91, and let's say most of the scores in the lower end of the average range, and then I see that academically, their skills are actually pretty good, except for maybe reading comprehension, which is poor, or reading comprehension and written expression, which are poor. I'd be inclined then to want to do some language assessment. I've often found kids with language processing disorders have lower IQ numbers, but they're academically competent, so they don't get picked up by districts because the districts say They're doing fine academically. They're doing what we want them to do. Yes, they do have trouble following directions and doing what we ask them to do, but if we just repeat things, they eventually understand it. That's not a solution. No. So it's a question of why is the IQ at 91? Is that an accurate reflection of what the child's ability is, or is that just an average?
That's a good point. It's just one score. You have to look at many domains, whether it's achievement testing, work samples, curriculum-based, assessments, and not just focus on one particular score to the exclusion of other sources of information. I mean, we're looking at the whole child, not just one domain, and whether it's a medical issue, a learning issue, a behavioral issue, hearing, vision, everything, processing, all of that can go into why the standardized tests come out the way they are. And again, that's why I always come back to parents should trust their instincts, their knowledge, because parents see their children in multiple settings. Schools see the child in one setting. Parents see them at school if they're in school, at home, out in the community. And what parents want to be able to say is, my child has learned something in school and can generalize that skill to another setting, home and community, because that's the purpose of all education, whether we call it regular education, special education, or anything else. Because as Dr. Kruger pointed out, we're not in school for the rest of our lives. This is a training ground, a learning laboratory for what happens after high school, after college, for the rest of our lives, wherever we're going, whatever trajectory we're on. Are we going to go off to college, vocational school, community college, get a PhD, a law degree, a degree in accounting, whatever we're doing. Right now, today, these first approximate 12, 13 years or more, if you want to count preschool, are the training ground, the learning laboratories for academic skills, social skills. And we want to make sure that everybody is getting what they need to get to that next step, from preschool to elementary school to middle school, high school, and whatever's happening beyond high school.
Just to circle back, the value of an IEE is to find out and answer the why, because sometimes school districts might acknowledge that a child is not performing up to grade average or meeting the academic expectation, but sometimes they don't go further to ask the reason why, or to probe why, and to provide the right evaluation to find out why, which is where the value of someone such as Dr. Kruger really comes in. Because unless we know the answer to the why, it's then very hard to provide the appropriate individualized instruction necessary to help that child.
So we're pretty much at the end of tonight's webinar. I want to thank Dr. Kruger for participating, and I want to thank all the participants who are still with us, which are just about the same number that we started with, quite a number. And I thank you all for taking time out of your busy schedules for joining us this evening. We'll continue these conversations throughout the school year and have people involved with special education and other areas that affect the lives of parents of children with special needs and special education. Jane and I will keep a watchful eye on special education law issues and other issues like the COVID-19 that affect our child's attendance in school and their progress. As far as legislation, I would just give a shout out. Please contact Senator Christopher Murphy in Connecticut about the Keeping Students Safe Act. He's on the Education Committee in the US Senate. It's a very important piece of legislation. Go on his website and we will get more information. Our next webinar is on December 7th at 7 p.m. And we'll be discussing a different dimension of parents' lives involving financial and legal planning for a child with special needs, especially as they become young adults. We will have attorney Jim Fennell, who's a special needs trust and estates attorney. We'll have Stephen Aarons, who is a financial advisor, joining us to discuss special needs trusts, financial planning, ABLE accounts, power of attorneys, guardianships, SSI, supplemental security, income, and Medicaid. So that's what we'll be doing on December 7th. And I hope everybody who's joined us this evening will continue to join us and stay tuned. And we will continue to look forward to your questions and have these webinars. Before I turn it over to Jane and Dr. Kruger, I want to just wish everybody a happy and healthy Thanksgiving, because that will happen between now and December 7th. And I especially want to give a shout out to my daughter, Rachel, who has done yeoman's work to put these webinars together. That it makes it look very easy to show up at the webinar, but there is so much work behind the scenes that goes on with the emails, with the recordings, the follow-up, getting us the questions. We have a whole list of questions that came in since the last webinar, and apologize we can't get to every one. So without further ado, I would turn this over to Jane and Dr. Kruger for their concluding remarks.
Well, I'd just like to thank Dr. Kruger for coming tonight, and apologies for not getting through to all your questions, but I think it really shows the value in the work that Dr. Kruger does and the real need for parents to understand more about the process of IEEs and evaluations in general. So it would probably be prudent of us to have you back again sometime soon, Dr. Kruger, because it's clearly a topic that parents, educators, and those within the profession have lots of questions and are looking for more answers for at this time. In terms of upcoming webinars, we've had some questions here in the chat. Rachel will be sending you out a recording of today's session. You're more than welcome to share that with friends, peers, and colleagues. There is a mailing list, so we will send you up-to-date information on the next series of webinars as we have those. So keep your eyes peeled for posters and flyers that we have coming your way, detailing what we're going to be doing in the new year and also for December. And I'd just like to say, wish everybody a healthy, happy Thanksgiving. And for those of you who celebrate the Hanukkah holidays, I think we will see you at the tail end of that holiday on the 7th as well. And just take care of yourself as well at this time. Take moments for yourself. If you look on the Jumpstars Facebook page, you can see that as well as doing this educational platform, we do social and recreational things for families and caregivers too, at no cost or expense to yourself. For example, this Friday night, we're hosting a flower arranging activity with Star at the Norwalk Wolf Pit location. We're doing something in a salt cave in December. So also, it's another way for you to connect in person for some of those recreational activities. So stay healthy. And Dr. Kruger, thank you so much for coming along tonight.
Well, thank you, Jane. I want to thank you and Larry Berliner for having me. It's been a great privilege and honor to be able to share my thoughts with your audience and with yourselves. I really enjoy the opportunity to interact and talk about these important issues. And I also want to especially thank Attorney Berliner's daughter, Rachel. She is really terrific and is very good at being organized and getting everything done that needs to get done. So thank you, Rachel. It was really great. Again, I do wish everyone a happy Thanksgiving and happy holiday season. And I look forward to coming back again.
You can be rest assured we'll have you back. Thank you. You're most informative, and we appreciate you taking time out of your busy schedule as well to be with us this evening. And so with that, we thank you and stay healthy and safe, and we'll see you on the 7th.
Thanks very much, everyone. Bye-bye.
Bye.